The Vibe at Vive is sponsored video content brought to you by MedCity News.
Hello and welcome to the Vibe at Vive. I'm Katie Adams, a reporter with MedCity News, and I'm here with Gary Lynch, the Global Practice Lead and Chief Technology Officer at Verizon Business. So first, I would love for you to explain the term tequity and how it fits into healthcare.
Tequity, wow. Yeah, it's a term I've been hearing a lot of lately, so I think it's something we kind of coined here recently. But, technology could either be a barrier or a conduit for healthcare, right? I think most of the time when people say tequity, they think about health equity, digital inclusion, and how can technology, add value. But it can really, it's really either a barrier or enabler, so that's kind of how I view tequity.
So could you describe Verizon's approach to empowering better healthcare experiences through connectivity? Because I feel like that really fits in.
Sure, yeah. Well, so I've spent my whole career working in healthcare, both on the provider side and the payer side. And as you know, we have a very fragmented system. And I guess the light bulb went off for me one day when I started thinking to myself, well, hey, I think the telecoms of the world are going to play a big part in the future of healthcare delivery because we can bring all those disparate systems together. All the constituents within the health ecosystem, pull them together and pull this fragmentation out of the system. So that's really what our focus is. I think of us as like the great enabler, if you will, connecting the entire ecosystem, both in the hospital and outside the four walls.
The great enabler, yes, that makes sense. Perfect. Well, I know that here at Vive, Verizon Business is talking about its work with UC Davis Health. So could you let me know more about that? And is it a new digital inclusion program?
It is, yeah. Super excited about it. I think just about every health system in the country, when I get on the phone, we're going to talk about health equity. We're going to talk about bridging the digital divide. And then when you look at what UC Davis has done, one of the more progressive health systems across the globe. And here we're going to be able to provide devices, tablets, connectivity to folks who are at risk that we can help to get them engaged in their health care. So, today when you think about those individuals, it's really, they're going to the emergency department for their primary care doctors. So we have a position or the ability to actually engage them in their health care, to improve access, to extend access to folks that normally don't know where to go for their health care.
Perfect. Well, that seems like it's certainly a worthy and exciting initiative. So thank you so much for telling me about it, and thank you for our conversation. I hope you enjoy the rest of Vive.
Thank you. You as well.